fact that Dr. Kerry Chant isn't here today, nor is anybody from New South Wales Health, do they endorse this plan?
We had a very productive and constructive crisis cabinet meeting last evening. That's the first, that's the last crisis cabinet meeting we'll have as we transition to a new subcommittee, a COVID and economic recovery subcommittee of cabinet. These changes today are measured, sensible, and ensure that we open up in a very safe way. I met yesterday for some time with Dr. Chant and with Minister Hazzard. We ran through a whole range of issues. We then took some suggested changes to the roadmap to the cabinet meeting last evening. It was a long meeting, but one in which I think was constructive, productive, and these changes today I think will make a real difference. We want New South Wales to open up as quickly as possible, as safely as possible.
What does it say, all respect for Dr. Kerry Chant, after she's led us through this for the last 2 years, that you wouldn't invite her here today as one of your first major press conferences as the new Premier? It is a bit disrespectful, isn't it?
Dr. Chant is one of my favourite constituents from Epping, and we have a great relationship and always have. But as I made the announcement yesterday, we are moving away from 11 a.m. press conferences. The health numbers will now be provided
it is a health crisis,
from next
so
week.
Chief Health Officer should be here.
It's also an economic crisis as well.
Is there any economists? It's just a whole bunch of politicians.
And as the new Premier, well, we're the elected officials, Chris. That is, and styles might be different and changes get made, but in my view, we had a very constructive discussion last night, and as the Health Minister has said, these changes are supported by the health team.
Were these changes born out of health advice, or are these your idea?
I sat down with the Health Minister and Dr. Chant yesterday. We went through some of these potential changes. We went through the opportunities to make some sensible amendments, some stable and steady amendments to the roadmap. And I think the changes today are sensible. And as the Health Minister has clearly pointed out, the fact that we've been incredibly successful in getting the vaccination rate up, and once again, I want to thank the health team here for their superb job. And at the same time, we've seen case numbers decline. So if you look at the position that the state is in, we're in a very positive position. And I think the changes we make today will have a real difference to people across the state. And particularly, I want to call out again that one in relation to funerals, because we know many people have made enormous sacrifices, and from Monday, I think that will provide the support for many families across New South Wales.
Critics are saying if you rush these funerals, you'll be having more funerals. Are you sure that you've got an endorsement from Kerry Chant on all of these changes?
Dr. Chant and the health team are members of the crisis cabinet. We had and will continue to also be members of the subcommittee moving forward. Yes, they have endorsed it. Yes, they have endorsed it. I think the Health Minister has made it very clear the changes today are supported and endorsed by the health team and the entire New South Wales government.